Ya Ali Madad. Today we're very pleased to have Dr. Dilshad Valliani, an intensivist working at the Royal London and a member of the Aga Khan Health Board. Dilshad, as an ICU doctor, I know you are passionate that everyone should take the vaccine. Can you explain why, please?
Thank you for having me, Akbar. So we're 10 months into the pandemic now, and whilst we know it's those highest risk group that account for a lot of the deaths, more and more, incredibly so in recent weeks, we've seen the effects that the virus can have on even those younger in the community, generally thought to be quite fit and well. Only this weekend at work, we've admitted patients in their 30s, 40s and 50s, come into hospital incredibly well and end up on a ventilator within the first 24 hours. So whilst the risk is low, even in these younger groups, the risk is not zero. So I do hope that in the future, as the vaccination program is rolled out more widely, all people who are offered the chance to have the vaccine will take it up.
Okay, great. And many people who get COVID-19 get better, of course, and yet some end up in intensive care. Who are these patients?
So over the last 10 months, the National Intensive Care Audit Committee collect data as they do in normal times for all ICU admissions. So they collect data about demographics. We now have data on about 25,000 patients who've been admitted to intensive cares across the UK over this period of time. Now, coming through in that data is certain things. So about 65 to 70% of these patients are of a male gender. We've heard a lot in the news about the risk to Black, Asian and ethnic minority groups. 16% of the admissions to intensive care are of an Asian background. And even when this is adjusted to match the local population, we know that this number is much higher than we would expect. So certainly there's a risk factor in being from Black, Asian and ethnic minority groups. There's other things such as deprivation indices and also other underlying sort of medical conditions. So body mass index, for example, about 80% of those admitted to intensive care have a BMI of over 25, which is classified as being overweight. And about 50% of those have a BMI of over 30, which is classified as obese. And this is something that we're seeing time and time again in most of the admissions that we have. Other things such as heart conditions, but also even well-controlled hypertension and diabetes is definitely associated with the risk of developing severe COVID-19. Worryingly, despite being admitted to intensive care, there's a significant mortality in these patients. So despite our best efforts and what we've learnt about the disease, mortality remains at about 40% across these patients. So it's really important moving forwards that we think about these risk factors and which of those are adjustable and that we can work on in the future to improve our health.
Okay, thank you for those really important facts. And it makes it even more important that we understand how high risk we might be and that we should take the vaccine. Some patients are worried about coming to hospital for the fear of catching COVID-19. What's your advice to them?
So as we know, in the first wave, the NHS was under a lot of pressure and a lot of non-emergency services were put on hold. However, by the summer, we were starting to get somewhat back to normal activity. So more urgent elective surgeries, hospital clinics, etc., blood tests, people were coming in and we had patient flow initiatives and ways of keeping these patients safe and segregated from the rest of the hospital to decrease their risk of getting the coronavirus. Unfortunately, the second wave has put significant pressure on the NHS once again, considerably more so than in the first wave. And so unfortunately, a lot of these non-emergency services are on hold again. Now, I'd say to patients, if things are non-emergency, please contact your GP, get advice where you can. And there are measures put in place where you can have virtual consultations and get advice over the phone for these things that might not require immediate face-to-face consultations. And that will protect you. But I will say, if you are sick and you do need emergency care, we are open. We do have patients in our hospitals and there are measures in place to keep you away and as safe as possible from those patients with coronavirus. So the services are still there. The doctors, the nurses, all the staff, we're still here to look after you. So please do come to hospital if you're unwell.
Okay, good. That's a reassuring message. Thank you for that. And you really are on the front line, Dilshad. So can you just share a little bit about your experience of what it's been like to be working in an intensive care unit during the pandemic?
So looking back to last March, there was a lot of unknown. I think in some ways it took us by surprise at how quickly things spread throughout our communities and how quickly we were inundated with cases in the hospital. There were a lot of unknowns. We didn't know what we were dealing with. And also there was a lot of anxiety about transmission of the virus and getting ill ourselves. Now, the first wave, just to put into context, I work in a very busy intensive care unit, which has 44 beds and is usually full at normal times. And we're very, very busy. In the first wave, we had close to 90 patients, most of those because of COVID-19. We had a few months where things seemed to be settling, but since October, we've seen a steady increase in the number of cases, and the rise has been quite exponential since the middle of December. Having worked this weekend, I left the unit with close to 150 patients, and almost all of those are there because of COVID-19. The staff are struggling, people are under a lot of pressure, and we're working way above and beyond anything that we would do in normal times. I know there's occasional reports in the media that this is just like every winter in the NHS. Whilst I know that winters in the NHS do provide considerable strain on services and we are always very busy, I have never seen anything like this. So this is far beyond what we see in normal times. And it's nothing like the normal influenza season that we see. They're not just old patients in their 70s and 80s. I've admitted personally very sick young people in their 30s, 40s over the course of just this weekend who walking down the street would be fit and well and actually don't have any underlying problems. I've admitted members of the same family, 3 in 3 consecutive days just recently. I can't tell you how difficult it is to have to talk to families of these people over the phone and explain to them how sick their patients are, and they can't even come in and visit. We only really allow one family member at the end of life because of the restrictions that we're under. And unfortunately, even sometimes this is not possible because they themselves are isolating. So it is very, very difficult, not just physically, but emotionally and mentally for everyone, for the patients, their families, all the staff and everyone that's involved. My only hope is now, with what we see is a slight trend down in the number of new cases and the promise of a vaccination, that there's some hope that things will improve. And certainly we're all very hopeful that within the next few months, things will hopefully return to some degree of normality.
Thank you, Dilshad, for sharing that with us. Very emotional, and really your personal experiences has sort of put it into focus in terms of just how difficult things are where you're working, and really sends home the message that how important it is to stay home, protect the NHS to save lives. So thank you for sharing that with us. So what is your one take-home message for the Jamaat?
So I guess my one take-home message, Akbar, would be echoing what you've just said. Yes, we have the promise of a vaccine, and the government seems very motivated and has put lots of plans into place to make sure that the highest risk for groups are vaccinated by the middle of February, which if we achieve would be incredible. But this doesn't mean that we have an opportunity to be lax and to let the messages that have been sent to us over the last few months just lay by the side for now. We have to be more vigilant than ever. So I hope that everyone stays safe, stays at home where possible, really minimize any social interaction that's not absolutely essential. That's the only way you'll protect yourselves and your loved ones and those in the communities around you, in the hope that things will return to some degree of normality in the coming months. I know it's hard. We've had an incredibly difficult year, and I know how much all of us are struggling with the lack of social interaction and the lack of normalcy and routine within our lives. It is incredibly difficult, but I can only hope if we're careful for another couple of months, things will start to return to normal and we can enjoy those things once more.
Okay, we really are now at the last hurdle, aren't we? So we just have to persevere a little longer. Thank you so much, Dr. Dilshad Valliani, for your thoughts.